Immunizations are a cornerstone of public health. The purpose of vaccines are to prepare the immune system to fight infections by exposing it to antigens in a safe way. Types of immunity include active immunity, which is long-lasting, where the body produces antibodies after vaccination or infection, while passive immunity is temporary immunity provided by antibodies. There are several types of vaccines. Types of vaccines include live attenuated vaccines, which is a weakened form of the pathogen. Examples of these include MMR, varicella, yellow fever, intranasal influenza. It's important to avoid in immunocompromised patients and pregnant patients. Inactivated vaccines are killed pathogen or parts of it. Examples of these include hepatitis A, polio, and rabies. Next, we have subunit, conjugate, or recombinant vaccines. These are specific parts of the pathogen. Examples of these include hepatitis B, HPV, pneumococcal, meningococcal. Toxoid vaccines are vaccines that contain inactivated toxins produced by the pathogen. Examples of these include diphtheria and tetanus. Lastly, we have mRNA vaccines. These deliver instructions for cells to produce a harmless antigen. An example of this type of vaccine are COVID-19 vaccines. To memorize all the vaccines that are live, you just have to remember COZY IV room. This mnemonic stands for cholera, oral typhoid, zoster, yellow fever, intranasal influenza, varicella, rotavirus, and MMR. Some general rules for all vaccines are: vaccines can usually be given at the same time. Multiple live vaccines can be given on same day, or, if not given on same day, spaced 4 weeks apart. If a vaccine series requires more than one dose, the intervals between doses can be extended without restarting the series, but they should not be shortened in most cases. For live vaccines specifically, MMR and varicella containing vaccines require separation from antibody-containing products. If you get the vaccine first, it's recommended to wait 2 weeks to take the antibody-containing product. If you take the antibody-containing product first, it is recommended to wait 3 months or longer to get the vaccine. Simultaneous administration of vaccine and antibody is recommended for post-exposure prophylaxis of certain diseases. You'll be asked to make vaccination recommendations. Therefore, vaccinations may be given, if indicated, in the following situations: mild acute illness, current antimicrobial treatment, previous local skin reaction from a vaccine, allergies, bird feathers, penicillin, allergies to products not in the vaccine, pregnancy, except live vaccines, breastfeeding, preterm birth, recent tuberculin skin test, immunosuppressed person in the household, recent exposure to the disease or convalescence family history of adverse events to the vaccine. Now let's review influenza vaccine tips. All patients above 6 months are recommended to get the influenza vaccine unless they are contraindicated. For patients ages 6 months to 8 years it's recommended to give 2 doses of the flu vaccine spread out by 4 weeks apart. Patients with egg allergies can receive any age-appropriate inactivated flu product, even if severe allergy symptoms. Egg-free products include Flublok and Flucelvax. If using a flu vaccine other than Flublok or Flucelvax in a patient with a severe egg allergy, vaccine should be administered in a medical setting under supervision of a healthcare provider. Do not administer live flu vaccine. In this case, patients with egg allergies cannot receive flu mist. Pregnant patients can receive any age-appropriate inactivated flu vaccine. Patients that are 65 years or older should be given Fluzone High Dose or Fluad. Now let's